My name is Dr. David Clarke, and I'm a board-certified gastroenterologist and internal medicine physician. And I'm here with Catherine Oxenberg, who has suffered from physical symptoms that didn't have a biomedical explanation. And we're going to talk to each other about this condition for the next little while and try to illuminate how it can be diagnosed and successfully treated. I'm the president of the Psychophysiologic Disorders Association, which I've co-founded and led for over 10 years now. And my interest in this topic goes back to the early 1980s, and I've interviewed over 7,000 people who had chronic pain or other physical symptoms, or both, but no structural damage, no organ disease to explain their symptoms. And instead, the symptoms were being generated not where they were being felt, but actually generated by the brain because of anatomic changes in the nerve circuits in the brain. And this cause of symptoms actually is present in 40% of people who go to a primary care physician. So it's very common. The symptoms can be every bit as severe as those caused by organ diseases or structural damage, but most healthcare professionals haven't had formal training in how to diagnose it or treat it. And so that's what we're going to try to communicate something about today. So with that, I'm going to have Catherine introduce herself.
Hi, my name is Catherine Oxenberg. I am American, even though I don't sound particularly American. I was born in New York City. I have been an actress since 1982 and was on a TV show in the 80s called Dynasty. That was the #1 show in the world and had a global viewing weekly audience of about 100 million people. And since then, I have been an actress for many decades. I then had 3 beautiful daughters who are now 31, 21, and 19. So I took a break. I got married. And since then, I have done less acting and I started producing. And then I got caught up in a situation trying to free my daughter from a very dangerous cult. And that took up a lot of my time. I ended up writing a book for Simon & Schuster called Captive, about my experiences and what it took to take the cult down because I couldn't get her out. Happy ending is my daughter is back and the cult has been taken down and the leader is in jail for 120 years. Suffice it to say, within 5 days of getting her back, which we're talking about 2018, and she and her boyfriend, now husband, were going to come and live on my post-divorce property, which was a 2.5-acre beautiful piece of land in Malibu. Everything burnt down in the Woolsey fire. So I got to have 1 bath. I got to have 1 breakfast that she made of pancakes. And the 3 children, myself and most of our pets, barely made it out alive. So in retrospect, from there, I met a great guy, thankfully, and we've been together ever since. So it's about 4.5 years. And my health fell apart. So I thought finally everything in my life was coming together after, I would say, a tumultuous time. And, life presents itself with challenges. And I've had acute trauma, chronic trauma. I score high on I think it's called the ACE test, the Adverse Early Childhood Experiences, as many of us have. But the process of losing my health so drastically took me on an unusual journey with, again, a happy ending, but it was quite terrifying. And so if I cut back to 2020, early 2020, all of a sudden I woke up and I couldn't move my hands and my arms were numb and tingling and swollen. And I already suffered from insomnia, actually, which I still do. So I'm going to be completely transparent about insomnia is still an issue for me. I had a combination of pins and needles, swelling, numbness. It spread to my feet. The pain then spread up my spine. It felt like I was being stabbed up and down. My head was in excruciating pain. I could barely walk. I couldn't use my hands. This all happened within like a 2-week period in early 2020. And
we should add that we're recording this in early 2023. So this is about 3 years ago for you.
Precisely. And it just got worse and worse and worse. And so I went to my general practitioner. I started to describe my symptoms. And he said, I think that, and he did a full blood work. And he said, there's really, your blood work looks fine. And so I'm thinking, well, where is this pain coming from? Because I literally, from being an active middle-aged woman, became non-functional. I had to ask my kids to open cans. I could barely use a fork. The pain was so severe that I couldn't lie anywhere comfortably at night. Everywhere, everything ached. And he said, it looks like fibromyalgia. And I went, I had a bout of fibromyalgia probably back in 2005, 2007. At that point, I was married. There were issues in my marriage that I actually sort of correlated that there could have been some like psychological cause to the fibromyalgia, which ended up resolving. But so I started asking for medication at that point because I was ashamed. It was like after everything that I'd been through in my life was now great. And I was a cripple and it was embarrassing. So I started to ask for, because fibromyalgia is supposedly irreversible. And I started Googling up the kazoo and, and it doesn't look good for people with fibromyalgia. I was even Googling sort of euthanasia places that people can't, the pain is so bad. I mean, the Googling is bad no matter what for people with chronic pain. So then this doctor started to give me, because I asked for like medication after medication, everything from different types of SSRIs to gabapentin to, I mean, literally like a closet full of pills. And they made me much worse. They didn't take away the pain, but it made me feel completely derailed. I mean, there was no way I could drive a car, I couldn't do anything. And so he started to send me to my GP to various specialists, starting with a rheumatologist. And the guy looked at me like, well, first of all, a little bit like I was a crazy person because you're describing all these symptoms and yet the pain is invisible. And I'm trying to prove that I'm really suffering. I'm in excruciating pain. And yet they look at you with a blank stare as if there's nothing much they can do for you. And this is a well-meaning person and, a good doctor, but presented with these symptoms that I had, there's very, very little that they offer. He put me on a drug called Plaquenil, actually, which he said would take 6 months to work to take down the inflammation in my hands. So, and then he suggested that I go and get neurofeedback. That was his suggestion. And he suggested possibly hypnosis, which I had tried in the past with limited success. And beyond that, not a lot of help. But he did say this. He said, with pain, if you have pain for like 90 days, then it's considered chronic pain. So that really sounded the alarm as far as I was concerned, because now I'm dealing with a ticking clock, that if I didn't resolve my symptoms promptly, that this was going to be my life. And he explained that once the brain is wired for pain, you can't unwire it. So I came home terrified.
This is unfortunately how most healthcare professionals are trained. Did either of these physicians, your GP or the rheumatologist, ask you about stress in your life, either past or present? Just curious.
I'll tell you one thing he said when I said that I also had insomnia. He said, well, what's stopping you from sleeping? And at that point, I probably wanted to strangle him because I was in so much physical pain. All I wanted was relief. And for him, it's like, and I remember like snapping back. I've done therapy my whole life. Like, it's like, I know what's wrong in my life, but it was like and I think that he was trying to hint at there could be a psychological component to my symptoms, but because he wasn't skilled and didn't understand it fully enough, it felt what's the word? It felt callous, actually, and insincere, like he just wanted to get rid of me. And I'm sure
Probably, yeah, dismissive.
It felt dismissive, and I felt like a stupid woman, and it's tough because I think that historically this has been an issue for women more than men, whether it's women being called hysterical, there's or psychosomatic or hypochondriac or all these things. There's always feel like you're defending your pain or defending your sanity. So I left feeling pretty dejected. But my nature is just to keep looking. And so I went over all of 2020, I went to see more specialists. I tried different medications. Again, nothing worked. And I will say, luckily, nothing worked, or else I would never have found the solutions that I was forced to find. And I'm going to cut a little bit forward because I eventually got in to see another rheumatologist. It took me 6 months to get in to see her. And she was a lovely lady. And by this time it was September. And so it was COVID. And we did a virtual, which is extremely unsatisfactory when you're dealing with physical pain to have like a virtual session with somebody. And she asked me about my childhood. And she asked me about my life. And she said, you are a poster child for somebody who develops pain in later life. And this was sort of the first moment of feeling validated that there wasn't something wrong with me, that it was something that had happened to me that predisposed me to these symptoms. But it really wasn't enough, because I said, well, what can we do about it? And she said, well, I can give you low dose naltrexone, I think. It's a medicine.
Yeah.
And I was hoping that this woman would not give me a medicine. She would tell me that that there was another way out. Because up until this point, what I forgot to tell you is the succession of specialists that I had been to see had given me everything from diagnosis of peripheral neuropathy, fibromyalgia, pre-autoimmune, connective tissue disorder, and arthritis, even though there were no markers, like undifferentiated.
So they're putting biomedical labels on you. They're giving you biomedical treatments. They're not investigating, even though you've been in therapy for most of your life, they're not investigating any of those issues. All right, sorry to interrupt. Normally when we're sort of doing this a little bit like I would with a patient in my office, except that with a patient in my office, I usually don't interrupt. I just let people talk because they give me so much information when I just shut up and listen.
You're so sweet. Well, the minute I shut up, then you ask me questions.
No, you're good. Just keep going. I don't want to derail your freight train here. So you're doing great.
So I was really frustrated with this woman, but I felt like at least I had been validated that there was an explanation for why I was in so much pain. But I have to tell you, it was excruciating. I couldn't walk. I certainly couldn't play tennis, which was something that I really enjoyed doing with my boyfriend. I couldn't even conceptualize. I still had 2 children living at home with me in college during COVID. And I felt like a failure as a role model, as a mom, as a human being, with everything that I'd accomplished in my life, that I was a pain, that my identity suddenly became about pain. And my life got smaller and smaller and smaller. And I didn't want to socialize, and I couldn't sit in a chair, and there was work that I had to do. And I just remember trying to put ice packs all over the place and having to break between filming, because at that point I was helping my daughter with her documentary about the cult called Seduced. And I had constantly had to ask for breaks because I was in so much pain, and there was really no relief. There was no relief lying down in bed. My body ached, sitting up, walking. It was just like nonstop. And I don't wish that kind of pain on anybody.
So this was not just your hands and feet then, this was total
know.
body?
Yeah. And what I learned subsequently, but I didn't understand at this point, is the pain moved. Like one day it would be worse in my left hand, one day it would be shooting pains, the next day it would be swelling, and the next day would be pins and needles. Like it didn't make any sense. And at
what did your I have to ask, what did your doctors think of that? Did you tell them that? Because that to me, that's a giant screaming clue that this is a psychophysiologic condition.
Nobody had an answer. A lot of them said, well, this is nerve damage. I thought maybe because I fell on the tennis court. I mean, I kept obsessing about what could have like triggered this pain, and was trying, I'm very sleuth minded, but it was obsessive to the point of like unpacking every single thing that had happened in my life and the precursors, and trying to make sense of it. And it was maddening. So I'm going to cut to November of 2020. A friend of mine just randomly called me up. Oh, and I did do probably 100 sessions of neurofeedback. And I have to say, during the session with this lovely doctor who also does CBT, I felt better. Like my brain had something to focus on. But I would leave this session and the pain would come back. And I'm thinking to myself, this is expensive. I mean, we're talking $250 a pop. There's no way that anybody could afford. Plus, it was my life. I would go religiously 3 times a week, and then COVID hit, and then there was no more neurofeedback. And boy, oh boy, the pain came back. And actually, I forgot to mention this. At that time, I came across in my boyfriend's office John Sarno's Healing Back Pain.
Oh.
And I read it, and I was like, this makes sense. And I brought the book to the neurofeedback doctor, and I'm like, does this make sense to you? And he didn't know anything about it. So I couldn't really. And the minute that I connected the possibility that my pain could be repressed, probably rage in my case, I had some temporary relief. But as is the case with those early Sarno books, there wasn't enough mapped out in terms of a process that I could adhere to that would like walk me out of the woods. And so
the full psychology and what to do about it.
Yeah.
Yes.
And I thought it was fascinating and it made sense to me. And yet my pain came back. And so it was frustrating. So sorry, but that was a little side note that I forgot.
Very, very important. Yes.
So my friend calls me and tells me that she has found a clinic up in Northern California, and she's going for ozone therapy. But something about the clinic and something about it's called BioReset up in San Jose, Dr. Matthew Cook, something about it, because actually desperation. My boyfriend put me on a plane and sent me out to this clinic. And this is not, and I want to specify this is not a ketamine clinic, but I think he's a functional doctor. He's an anesthesiologist, and he does a ton of different anti-aging, but also pain relief. It's a very comprehensive clinic. I went up there just feeling pretty dejected and hopeless. And there's nothing like pain making you feel like you have just been sidelined from life, that you actually don't have any value. And I was thinking, I don't want to live. There were two parts of me. One was I refuse to live like this. And the other part is I'm not going to stop until I find an answer, even if it's, in a different dimension at this point, because nothing was being offered to me. Nothing. Everything that I was being diagnosed with were irreversible conditions that I was going to have to tolerate, manage my pain with dignity. Those, that's kind of the message that you get, but you're not really told that there's an option to move beyond the pain. And I get to this clinic, and this doctor spends a lot of time with me, at least a couple of hours, and he's asking me about my history, and he's asking me about my childhood, and he's asking me about my stressors, and we're not just talking symptoms, we're talking about my life. And he looks at me and he goes, you're going to heal. There's no doubt in my mind that you are going to heal. It is your birthright. You're already healing now. And it was, if doctors only knew about the power of being a medic, but an authority figure, and what that does to a patient, it was the hope that opened the door for me. A little hope goes a long way. And whether I believed him or not in the moment, it changed my mindset. And the time that he spent with me, which was really about set and setting, because he was preparing me for my first IV ketamine treatment. And what I got, which is very unusual, I think either people go to a ketamine clinic and they get a ketamine infusion, which is an IV experience, which is therapy, but it's not psychotherapy. And
just for people to know, ketamine is an anesthetic.
It is exactly a dissociative anesthetic. And I was given a low dose. And I'm going to talk a little bit about this, even though it's not mind body, because I think people need to know. For chronic pain sufferers, low dose ketamine IVs done properly, and the way that it was done with me was extraordinary, can be a game changer, because it pulled me out of what they called my default mode network, which is how my ego, my operating system is organized. And right now my brain was indiscriminately firing pain. And it took me out for about an hour, gave me a break for myself. And so I got to recalibrate, and I got to see, and I had an experience of, this isn't me. I'm bigger than all my traumas. This part of me is intact. This part of me is quiet. This part of me knows how to heal. And this part of me knows that it's me that has to heal myself. So once the noise is gone and you have enough quiet and you're out of fight and flight, which is what this medicine does, long enough that you regulate your nervous system, that you can see, the forest for the trees. That's what it gave me access to. And everything changed after that. And what this doctor did, which was great, is number one, the time that he spent with me was really about setting an intention. And the intention was that I could heal, which not everybody gets that. And then
they should, but yes, they don't.
They don't. And so that's why I'm talking about it, because if it's done properly, this is an incredible catalyst. And I was out of pain immediately. And then when the pain did come back, it wasn't the same. It wasn't the hopelessness and the despair, because I had touched the place in me that was pain-free. And I've got to tell you, from there, all the doors opened, because literally within a week I found Curable. Literally. Everything, the floodgates of possibility opened up.
So our viewers who don't know, Curable is an app that incorporates a lot of very evidence-based mind-body healing techniques. It's available for smartphones and computers for an annual low subscription fee. I'll just point that out.
You need to point out that if people can only afford one thing, I would send people to Curable, because it is, I've just got to talk about Curable for a second.
Yes.
It's extraordinary. First of all, it was so obviously curated by people who had so much compassion for pain sufferers. So of course I found out it was from 3 recovered pain sufferers. And just the way that they talk to you, understanding that you don't have a lot of patience, and that you can only be asked so many questions, and the way that it's so impeccable. And the science, they talk about knowledge therapy. And for me, I inhaled everything on that app. I listened to every podcast. That's how I found you. I did the group. I knew that the answer for me was that app.
Yeah. For full disclosure, I am one of their consultants, but I'm just one among many. They reeled in, all of my best colleagues from around the country and overseas as well, and took all of our best ideas and put them into this wonderful user interface.
It really is extraordinary. It's extraordinary. It's the best thing out there, I got to say. So I would say that the ketamine for me was the catalyst for my healing and recovery, but the mainstay, the bread and butter of my healing was Curable every single day. That was my go-to. I use that panic button, I don't know, sometimes 10 times a day. And I don't go to Curable that much anymore, but I do if I need, and I recommend it as a tool for everybody and anybody because it's so accessible and it makes so much sense. I mean, they have really curated an extraordinary breadth of wisdom and experts. I'm really grateful beyond belief. So from Curable, I came across Nicole Sachs's work. I came across you through the group, and I loved your talk. I came across Dr. Dan Ratner. And with Nicole, what I loved about Nicole is I probably had been doing inner child work since the 80s. But I had never done therapy that combined this idea of my symptoms were a form of communication from my subconscious, both a distraction and a communication. And the writing got me in touch with, I guess, from Freud's standpoint, my id, which is that little 5-year-old, the raging 5-year-old. But as soon as I started to connect the dots between what my symptoms were trying to protect me from and at the same time communicate, it opened up this dialogue between me and my subconscious that has, first of all, I would say, look, I'm not grateful for the pain. I don't wish pain on anybody, but I have a deeper relationship and a more authentic relationship with myself today than I've ever had in my life. I have the ability to communicate with parts of myself that most people never get to access. And I'll jump back to the ketamine for a second, because if we think about the subconscious is really, my subconscious speaks to me through my intuition, through symbols. It's like through my dream state. Ketamine allows me to access that consciously, allows me to access that right brain intuitive side so that I'm reaching into my subconscious all the time. And there's an amazing exercise on Curable. I think it's the identifying emotions exercise.
Okay.
And you ask your subconscious, you say, please communicate to me what these symptoms, what you're trying to express through these symptoms in a way that I can clearly understand. And it's very powerful. Like at first I didn't believe that I would get a response. And as soon as I let go and just trusted, the response comes. And now I have this extraordinary dialogue with myself. And it doesn't mean that I don't have symptoms. What I've learned is to downgrade. It's like, I don't call it pain anymore. I don't call it even symptoms very much of the time. I can call it sensations.
Yeah.
And
And when you can relate to those sensations as your brain's way of trying to communicate that you're upset about something or you're angry about something, and use those symptoms as a pathway to self-understanding, that's one of the best ways to heal the symptoms. And it's wonderful that you found the pathway toward that. I
it's
should also add while I'm talking here that the ketamine and the other psychoactive drugs, whether it's mushrooms or MDMA, we don't yet have randomized controlled trials on large numbers of people who are suffering from psychophysiologic pain or other symptoms. But we are hearing from individual anecdotes of significant improvements when those are used. But we don't know if that's going to work for everybody or what the side effects might be when you're using them in large numbers of people. But they do seem to have benefits of what we call perhaps accelerating neuroplasticity, the ability of the brain to heal itself or to change those neuroanatomic pathways I was talking about. So I wouldn't say they're necessarily for everybody, but like I say, we are hearing from individuals that they've had benefit from them. So they remain an intriguing option. And those of us who are try to take a scientific approach, we're waiting for more data.
I think that's accurate. I would say I'm, the more I understand about symptoms, the more I feel like so much of depression and anxiety is really, it's another symptom. I mean, and so if these medicines work well for treatment-resistant depression, which to me is an emotional symptom, it makes sense if a lot of these symptoms are sort of unresolved trauma potentially, or that they could help. And actually, my nonprofit is doing the first pilot program in March for a group of sexual assault survivors for ketamine-assisted psychotherapy. So we will be gathering data,
Excellent,
research to pass on to see whether or not we are successful. And but along those lines, I think it was really important for me because my healing journey cost me an arm and a leg, and I went down a lot of dead ends, and it was pretty terrifying, but also hopeless. There were times when I felt hopeless because there were so many doors slammed in my face. And so one of the things that I'm doing with my eldest daughter is we're doing this website called Helix 180, where we want to talk about recovery from chronic pain and PTSD and promoting these other options that we hope are going to become more mainstream, the PPDA and so on and so forth. Because if there are 50 million people in this country suffering from chronic pain, they deserve some help. And I truly believe in democratizing healing. And I know that ketamine is an expensive protocol. And it's at least it's legal, which some the other psychedelics are not legal, but I'm sure they will be legalized as down the road. But if there was, and I believe that you can heal without ketamine. I just needed a break from myself.
Oh, absolutely. I mean, this condition comes in a spectrum, as so many medical conditions do. There are people who read Dr. Sarno's book and were healed by that, in a matter of days, just by reading that one book, because they were at the point in their healing journey where that was enough to get them over the top to a pain-free state. And then there are other people who are at a different end of the spectrum, who need ketamine or need years of psychotherapy to achieve the same outcome. So everybody's different, but if this approach is applied to the tens of millions of people who are suffering from psychophysiologic disorders, the outcomes are going to be better, some quickly, some more slowly, but always going to be better than they would be without this approach. And it's better for the healthcare system. It's far less expensive to the system to achieve the correct diagnosis than what essentially amounts to no diagnosis at all, which is what you had. And it's better for the physicians. These are patients, 40% of the people who come through the door of the healthcare system. Very frustrating if you don't know what to do for them. They're the kinds of patients that make doctors beat their heads against the wall, and you can turn them around completely when you learn how to do the diagnosis and treatment correctly. There was one family doctor I love to quote who took me aside at a conference a few years after she'd learned how to do this and said, "This has put the joy back into my practice, because now these patients who were so frustrating for her are rewarding because of how well they do." Okay, sorry, onward.
No, I love hearing you. I wanted to say that Dr. Cook, he said to me, I used to hate treating people with chronic pain. I used to run in the other direction because they're just like impossible patients. And so, and that is the fear of the patient too, the shame of the patient. It's like there's patient shaming because you feel like you're making the doctor look bad.
Yeah.
But what I wanted to say is go back a little bit about the steps of healing. And I know that it's different for everybody, but so I found Curable. I dove in. I learned everything about pain that I could. And I read The Meaning of Truth by Nicole Sachs. And I have not worked with her as a therapist. She didn't have any room for me. But I really think she's fantastic. And her writing style did something a little different. So there's a chapter in her book, and she describes this situation of, and this was very, very helpful for me in terms of learning to resolve my own trauma. Because truthfully, I'm the only one who can connect all the dots of my history, right? Only I know everything that happened to me. And every time I was having a symptom. So in the story, she describes being very upset that her son, 8th grade, I think, was failing some class, and her husband didn't seem to care, and the son didn't seem to care. And she's like, why is this bothering me so much? So she did her writing, and she said, I feel so alone. And suddenly she remembered being a child in school, in the cafeteria, alone, with no friends. And she could see herself, judge herself, and go, you're a loser. I don't want to be your friend. And suddenly that was me. Like, it hit me very hard. I remembered being that girl and of feeling like such an outcast and so not knowing such an outsider and not knowing how to fit in, not knowing how to make friends. And the self-rejection is what hit me. It's like those moments in time where, as you're growing up, you don't have the resources to remedy the situation. And so you abandon yourself. And I realized in that moment, I'm like, I've never done that type of therapy where I go back and I get that frozen piece of myself that I rejected and apologize to her and go. And, part of Nicole's thing is like, how did that made me feel about myself? Well, like a loser.
Yes.
Like,
And, anybody who didn't know you or have access to your inner world would find that very hard to believe. I mean, you went to all these prestigious schools, you're related to European royalty, you went to Harvard, you went to Columbia, you grew up partly in Europe. I mean, no one outside of your life would look at that and say, this is a person who thought of herself as a loser. But it's so common in my patients that they had experiences that made them feel like second-rate human beings, or worse, like worthless, pieces of crap that
yeah.
and most of the time you can't tell that the person has been made to feel that way on the inside. But it is absolutely a common denominator in my patients who experience childhood stress, that a common denominator of that is feeling like they're not measuring up to other people. And that can happen in so many different ways. It can be out and out abuse that someone suffered, but it can be a lot more subtle. Just being made to feel like your best work isn't good enough, or you jump over a certain bar of achievement and the parents are like immediately onto the bar that's the next highest rung up the ladder that you now have to jump over. Something as simple as that, if it's repeated over and over, can make people feel like, I just am not ever going to be good enough. And they carry that with them, and it has all kinds of long-term consequences. So maybe we should talk about that a little bit. I mean, go into a little bit more detail about whether you had those kinds of experiences as a kid, because you alluded to being in therapy from a very young age, and that doesn't happen for nothing.
I was spurred into therapy because I was struggling with bulimia from the age of 16 on.
Okay.
And I didn't know how to stop throwing up. And so when there's something that obvious that is not functioning, that is a good, that was a good kind of reason for me to get help. And I went through everything. I went to rehabs. I was in every form of therapy you could possibly imagine. And it was a 20-year struggle. And in fact, even at one point, I think around the time that MDMA was still legal, I did a therapeutic session of MDMA back then to try and help my bulimia. I have not had, that was a long process, but I would say that opened the door for me understanding, without getting specific, when you grow up, there was mental illness in my family, and it was tumultuous, my childhood. You, as a child, that's all you know. And
That's
so
right.
you adapt, and you don't know that there's anything wrong with your circumstances because we're incredibly resourceful as children.
And none of us has a parallel life to compare ourselves with.
That's precisely right. And a lot of the messaging that I got was, well, there was a, and there's different types of abuse. There's overt, there was physical, there was sexual. There's also neglect. When nobody sees you, nobody reaches into you and asks and talks to you. And my generation was a little bit different. It was really truly the eat up, sit up, and shut up generation. You and I are the same age, so I don't know how you were parented, but it was a different style. Our parents were coming out of the Great War. We were lucky we had food on the table. I wasn't starving, but it's like there was no kind of dialogue to reach into a child and ask if you're okay.
Yeah, and all of that sends the same message of basically devaluation.
So what I like to say is I reverse engineer my life. And if I'm dealing with excruciating pain, that means that everything comes from somewhere, is what I've learned through this healing process.
Yeah.
That what the pain that I'm feeling in my body is directly correlated to unresolved traumas that I have never reconciled. I have never really resolved. And as I go back and I unpack those pieces of myself bravely, because nobody wants to go back, and my daughter and I call this process turning kryptonite to gold. It's really the reaching in to those parts of my psyche where there are wounds, where there's shadow, and seeing them for what really happened and the impact of it frees me and frees my children. I do it for, it's about how do you heal intergenerational trauma as you go in there and you see how things really did impact you with adult eyes. And it's a very profound, I mean, for me, it has taken me, it's been a 2-year process of me digging in. I won't say that it's easy. And I don't believe that everybody has to go through what I went through. As you said, people have had book recoveries from just reading and understanding that their symptoms are repressed rage, and just the understanding of that has completely transformed their lives. For me, it seemed to be that I needed to go in and attend to a lot of those places.
It can take decades of sort of preparatory work going on subconsciously before a person is ready to take the steps you just described.
It was interesting when I got on the table to do ketamine for the first time, as the medicine was going into my bloodstream, it hit me. I'm like, wow, it was a lot worse than I ever knew. It was a lot worse for me to be in this state. And at the same time, it's like God's mercy is I'm being given the medicine to help me resolve and heal all of that trauma at the same time of having the realization that it was much worse. And I think for most children, we don't know how bad it is, but
children do not. Like I say, there's no parallel life to compare. And so they simply react and adapt to what's around them. And I should just to connect some dots here, at least in my patients with psychophysiologic disorders, the eating disorders are a form of self-treatment. They are a way of gaining some measure of control over something when they're in an emotionally chaotic state. And by controlling their body, whether it's anorexia or bulimia or both, that gives them something they can control. And that's extremely valuable to somebody who's dealing with emotional chaos. And I have found that a lot of my patients who have undergone traditional eating disorder psychotherapy, it hasn't touched the benefits that they're getting from their eating disorder. And that's sometimes why, it can take 20 years for a person to recover from it, because they have a benefit from that eating disorder. It's a self-treatment that is giving them something they're not getting from anywhere else in their lives. And if the psychotherapy is missing that point, it's not going to be as effective, and the recovery consequently is prolonged.
I 100% agree. I also think that when I imagine like the violence of bulimia, and the trauma of like overfeeding to the point of like needing to purge, and how violent purging is to the system, is that's tantamount to the degree of rage you're trying
Yeah.
to. So I see it as more than control, as the body is acting out immense reenactment of trauma. Like, get this out to the point of like risking your life, because it's very hard on the body. So, it is a desperate acting out of like severe trauma.
Yeah, and a lot of people who suffer from eating disorders feel shame about it, that they can't control it, and that it's obviously not, a pleasant thing to experience. But I try to reassure them that these responses to trauma are nothing to be ashamed about. They are simply a response to trauma.
Yeah, it is shameful when you have behavior that you can't control. It's very shameful.
But it's just a measure of the level of a trauma and emotional injury that a person has suffered, that they are resorting to this as a form of self-treatment. And the cutting behavior is another one. It's my patients who have engaged in that, it's a way of feeling something when they have had to suppress almost every other emotion in order to get through their day. And it's not a pleasant state to be in, to have all of your emotions repressed. And so by cutting, they give themselves a way to feel something. It's another form of self-treatment. Absolutely nothing to be ashamed of, because it's a way of taking care of yourself, even if it's not the most pleasant.
I was going to say, so some of the work that I did with Nicole Sachs's book is, and Dr. David Schechter also suggested, like, starting to rage. Because, I'm a good girl. I have all those characteristics of a pain person: goodist, perfectionist, people pleaser, all of those things. And so I started really getting in touch with the possibility of being much angrier than I knew. At first, I would get in my car, excuse me, and I would just scream. And then I started to realize I'm really angry about it. Absolutely everything. Everyone pisses me off. Everything pisses me off. So once, because it was like a foreign language that I would immediately somatize into my body and have a physical response. But the truth was, when I started to really register how pissed off and that everything was triggering me, and get really honest about, because at first I couldn't even identify it as anger, which was really interesting. So
How old were you when this was happening?
well, this is 2020. This is
Oh,
2021, but
okay.
it's quite old. 2021, I got in my car and just started screaming like a banshee. Then I was able to refine it. I'm like, okay, now I can I could rage on the page, which I did a lot. I even did this morning. I did some raging on the page. And then I learned to refine the process by raging internally. So, and that could mean that I'm sitting somewhere and I'm not having a pleasant time, and I blow somebody up in my mind just as because it's pissing me off. So I let that raging 5-year-old express without saying, you're a bad person, you shouldn't think like that. Like, what goes on in my head is my business and nobody else's business. It doesn't mean that I'm an ass to other people, because I'm always going to be a goodist, but it means that in my relationships, I found a different voice at my age. Somebody who's more assertive, somebody who stands up for themselves, somebody who doesn't take crap. And at first it was quite scary. It's like the symptom is pushing me to stand my ground. But it's literally like I birthed a new part of myself through owning my anger. And I would say step one was my anger, like big time, maybe a year, warning you guys,
Yeah.
a year of getting in touch with how angry I was. Then the next step, and it wasn't necessarily so linear, but it did come in stages, was immense grief, immense fear, and understanding that, really getting in touch with the fear and the grief. And then understanding through the grief, oh my God, what have I done to my children that was done to me that I couldn't see? And some of that was neglect, not being able to be there for them, for their emotional needs. And I went and I made amends, especially with my baby who was 19. And I don't think I felt grief and shame like that in my entire life. So I'm healing for my kids. I'm healing for myself. It's best doing a best repair that I can imagine. And apologizing to them, it's like the apology that I always wished for myself, I've had to give to my kids. That's how I get it.
There's so much that I know people watching this will be able to relate to. I guess we can start with the personality traits that people acquire in adverse environments. That a child um, doesn't have that many options for how to respond to an adverse environment. And often what they do is they try to be the best little kid they can be. They try to be perfect. They try to be good. They try to take care of the needs of others in that environment. They try to do everything that's asked of them. They're extremely self-critical when they fall short. They blame themselves when the adversity takes place again and they haven't been able to stop it or minimize it. And then the emotional reaction, and then they carry those personality traits well into adulthood. And then the emotional reactions are suppressed. It's not going to help you live through the adversity to have those emotions be expressed. And so kids get very good at repressing them. And it's anger, fear, shame, grief, guilt in varying proportions. In my patients, anger is usually the biggest, but not always. And certainly the others can come in. And people, as children, get so good at bottling those up that it can take decades into the adult years before they can get consciously in touch with them. And ironically, sometimes the final step in getting in touch with those emotions is when you um, have achieved a self-esteem for yourself that brings a positive person into your life, that you finally feel worthy of having someone in your life who recognizes your quality as a human being and expresses to you that you are a quality human being. And you finally begin to believe that, actually, I am probably a decent human being. And, when you finally get that person in your life, it's obviously a great thing. But at the same time, it is a contrast with what you have experienced in the past. And it begins to lead to almost an inevitable question, which is, well, if in fact you are this wonderful person that you're being told you are, and you're believing that you are, then you really didn't deserve everything you had to suffer in the past. And that's what causes the anger to start knocking on the door. But if you learned as a kid to take that anger and bury it, then the door that the anger is knocking on is not your conscious awareness, it's your body. And
Yeah.
so instead of screaming in the car, you are screaming into your physical self, with the result being symptoms. Um, and it takes a lot of healing before you can uh, shift the anger from bodily expression into verbal expression, whether it's screaming or writing. And you went on that journey and you accomplished it in a year, which is a tribute to your determination.
Well, I would say thank you, longer than a year. It took me a full year from when I found Curable and the ketamine therapy. It was a full year of being in the trenches. I didn't have like a miraculous book recovery. I had to work through it, and I would have flares and it would come back and then it would subside and I would be, but I never, once I touched it, it was like I didn't give up. And so I just want to, for other people listening, it was a lengthy process for me. And like you said, it's 2023. So it's been a 3-year process, really. Now, there's a couple of things I wanted to mention. As I was doing therapy in a different way, I got to review the chronology of my symptoms from my childhood. And all of a sudden, my whole life looked very different. I couldn't say that now suddenly out of nowhere, a health crisis. If the truth be told, from the very beginning, I had symptoms. I had, when I was little, I would say I thought it was stomach flu, but it was constant IBS, constant, um, awful, horrible stomach pain. I had allergies that were so bad that I would have to spend the summer on a couch with like a towel with my face, like over my eyes.
Mhm.
Headaches. I had hepatitis. I was constantly symptomatic. I thought I was weak. I probably had chronic fatigue. I couldn't run more than 100 yards without hyperventilating. My body really was speaking loudly from the very beginning. And so it was just interesting to go, oh my goodness, so many symptoms that were non-structural, that were me desperately finding ways to express emotion. And you
Yeah,
said
it's
something.
very common for me to have a patient tell me about the 2 years of their symptoms, and then as we talk, and I start asking about their childhood experience, then I hear about more and more symptoms that they've had earlier in their life. So yeah, very common.
Very again, maybe the lens through which I see my childhood versus thinking there was something deficient and broken about my body and weak. Not at all. I was just storing things as, as refined as well as I could, given circumstances where there was no room really for any emotional expression other than to somatize. So very resourceful. So my whole life just looked very different as I went through this process of understanding how the body works and how the psyche responds to less than stellar environments. And that's all I'll say on the subject. But I remember you saying that symptoms very often result as from volcanic rage at people we love very much.
And that's the hardest, that you've buried this rage. You want to have a positive relationship with this person. You want to forgive them. You want them to acknowledge that they've committed transgressions, and for them to ask forgiveness of you, so there can be a reconciliation. And if you unleash the volcano in their direction, it's going to ruin the possibilities of any kind of reconciliation happening. So that encourages people to keep these emotions buried. It's very, very difficult. It's even more difficult for my male patients than my female patients. They find it, it takes often years to begin to approach this.
Well, I will say this. The more I give myself permission to express, the more energy I have to help other people. So, once the cork comes out, it's like this exuberance and overflow of life force that's been suppressed my whole life. It's like, oh my God, I feel so good. I have a second lease on life. I just want to be able to like pay it forward. So if that's an incentive for people, it is for me. And I wanted to share that my now 19-year-old, when she was 16, she started to get mind body stuff. And we didn't know. It was before my diagnosis. And they thought she had juvenile arthritis and she couldn't use her hands or her feet. So I took her in a wheelchair to UCLA. They diagnosed her. And then subsequently, like 2 weeks later, I had the same symptoms, strangely enough. And I went through this whole process of understanding mind body symptoms. And the result of that is she now doesn't have symptoms anymore
Oh
because she
my goodness.
understands that her body was expressing and she doesn't need to do that anymore. And that is miraculous.
Yeah, that's a wonderful outcome. So many of my patients have, because of their own struggles, it has impacted their parenting, and often they um, wish they had done better, let's put it that way. But what I try to reassure people is that as long as you can do better for your own kids than your parents did for you, you are moving the generations in the right direction, let's put it that way. And parenting is such a difficult task. I've had 2 kids myself, and none of us does it perfectly. But as long as we can move the generations in the right direction, I think we can count ourselves as successful.
Yeah, I definitely have regrets, especially when I look back over my children's lives and realize how much chronic fatigue I had and that I didn't have I made them meals every day and took them to school, but I didn't have energy to pick them up from play dates, and they felt embarrassed, like they weren't good enough because kids are always going to take it upon themselves. And I realized there was a cost to my symptoms. And so, but I think the dialogue of understanding and explaining and healing, there's been a lot of like healing as a family, which has been very beautiful. And I wanted to say there was a period of recovery where I hit a plateau, and that was frustrating. It was like I kept being symptomatic. Like would go back to being symptomatic. And so I found Dr. Dan Ratner's work, the Crushing Doubt work, and I signed up for his workshop. And actually he does, and I love this about the doctors in this field, is that everybody has a little bit of a different take. And so for me, it's been very helpful to take from from you, from Curable, from Dan, from Nicole. And what he said is he talks about power. And that was very helpful for me in terms of getting to the next level of my recovery and accepting the fullness of my trauma. And so when I started just with that mindset, I went deeper into my childhood and into the repercussions of various things that I had gone through. And that really helped free me. And he also believes something that's unique to him, I think, which is that the onset of symptoms actually means something as opposed to.
Yes.
And he's unique as far as that, because the the pain psychology center, like there's other theories that it's just your nervous system reacting. And so I find that to be true. Whether or not I can be bothered to tune in and register exactly what it's talking about, because sometimes there's a lot going on, but the level of intelligence that he attributes to the body and the subconscious is really, I think, extraordinary. And his take on power, and that a lot of Buddhists have a negative relationship with power being a force for good and them being a force for good and us standing in our power being a force for good. So that he's been very helpful for me as far as that. So I've had kind of an extraordinary group of.
Yeah, it's interesting. None of us who work in this field knows everything, and what we do know, it can be very valuable to a particular individual at a particular stage of their healing pathway. And then another one of us can be particularly valuable at a different stage of their healing pathway. And we've all seen this many times. You're reminding me of an exercise that I often have my patients do to help them understand their own power, which is to imagine that you're a butterfly on the wall of your childhood home, watching your own kids try to cope with that environment for a week or 10 days. And you can't do anything because you're a butterfly on the wall, and you just have to watch your kids try to deal with that situation. And the reason for that, I mean, it's not a very pleasant exercise to go through, but the reason for doing it is to give you a more accurate sense of what things were really like. Because when people look back at their lives, they don't necessarily perceive things as accurately as they could. There's just too much emotional repression that's happened to fully understand what it was really like for a 6-year-old or an 8-year-old. But when you imagine your own kid trying to cope with the same thing, then it becomes a little more real. And that helps people gain a lot of respect, a ton of respect for what that little girl or boy did back then, what they had to cope with, not just for a week or 10 days, but for years and years and years that they had to put up with adversity. And when you internalize that self-respect, your own heroic perseverance for coming through all that, it gives you a much better and more accurate sense of your own power, which has ripple effects on lots of other areas: the goodism, the perfectionism, the helping others to your own detriment, the excessive self-criticism. All of those things begin to diminish when you start seeing how truly powerful and heroic you were.
It's beautiful. Thank you.
And now you're using it to help others, which, in a variety of ways, not just rescuing your daughter, but helping others with along this healing journey, of which so many millions have not even taken the first step.
Well, thank you. I mean, I'm trying to incorporate the mind-body philosophy through this immersive quality process, which we're developing. We're doing it in the Bay Area in March, and it'll be a 10-day process for sexual assault survivors. And I haven't quite figured out like how to present the mind-body stuff, but it's like an important part of the process. So we'll see.
I'm sure you'll do a great job with it. One other area I should touch on as one of the 3 long-term impacts of adverse childhood experiences, the first 2 being personality traits that can be stressful and repressed emotions. And the third one is triggers, people, events, or situations in the present day that are triggering pain or other symptoms or emotions because of the fact that they are in some way linked to or reminiscent of the past. And a lot of my patients, that's why their symptoms flare up, or that's why their symptoms began in the first place, that there is some kind of trigger going on that they might not have fully recognized. The most common trigger is somebody who mistreated you when you were a child and who is still in your life to some degree, and that having that person with issues not resolved can certainly be a trigger. But there are other things, having a workplace supervisor who treats you disrespectfully in a way that reminds you of how you were treated as a kid is another common one that crops up. But lots of those issues are common in my patients, and I always look for them routinely in an ACE survivor.
That is good feedback. So what do you tell them when somebody understands that there is that correlation, then the nervous system just downregulates?
The nervous system can react with physical symptoms, pain or otherwise. And again, those symptoms are, in a way, the body's way of signaling that there is something distressing going on. And as you've learned, you can pay attention to those symptoms as a signal that there's something emotional or stressful that needs to be attended to. Um, if if people have done the exercise I mentioned earlier about the butterfly on the wall watching the kid, and they've grown their sense of their own power and their own heroism, that gives them a basis for setting firm boundaries between themselves and the trigger. It's difficult to keep the impact of a trigger to a minimum until you feel you deserve it. So I want my patients to um, develop their self-esteem to the point where they're basically saying, I'm not going to put up with this trigger anymore,
Mm,
or I'm going to limit the interaction with this trigger to the point where it doesn't make me physically ill.
mm. Okay, that makes sense. That makes a lot of sense.
Well, let me, we're in a pause here. Let me take a quick look at some notes that I made to see if we've covered everything. Or we've covered a lot, that's for sure.
Oh, we did it. We did it fast. Good. It was time.
Oh, I should briefly mention that another form of coping can be various behaviors. A way of self-treatment for the emotional consequences of adversity can be using drugs, using nicotine, using alcohol, but also things like addictions to food, gambling, sex, work, exercise, shopping even. I have seen in a few patients. Hoarding is another one it's fairly rare, but I have seen it. But these are all, again, behaviors that people tend to be, you know, look down upon in themselves or be ashamed of. But again, they are simply ways of coping, ways of minimizing the emotional pain of what a person has experienced before. And so when my patients have gone in that direction, I want to reassure them that it's simply a reaction to very high levels of emotional pain, let's put it that way, and that this is not something to be ashamed of. It's something that people resort to when they don't have any other options that they can see in the moment. And there are ways of avoiding killing yourself, frankly, that people who see no way out, that's, those thoughts start coming to mind. And these addictions or behaviors can be ways of saving themselves from going down that road while they search for some more constructive way to heal.
Mm. Wow. Goodness.
Any other thoughts or words of encouragement, perhaps, to people who are just beginning their healing process?
Well, uh, the fact that there is light at the end of the tunnel and that there is such a thing as a pain-free life, and that is a reality, it's not delusional, is really important for people just to believe. And I'm not saying that I won't ever have pain, but I'm not afraid. I think that was one of the first things that I learned through Curable, is to separate the pain from the fear, because my pain was triggering fear, and then I was generating more pain. But the minute that I realized there was nothing wrong with me physically, and that I was just reacting in a certain kind of tokenized way, my nervous system, and that there was nothing for me to be afraid of as far as the sensations in my body, then I could ride it. I could ride it out. And then, but I just remember, I mean, I needed a therapist. When I had so much trauma that came up, that when I was starting to do Curable and the exercises, there was so much coming up. I'm like, this is unmanageable. I need one-on-one. So I did find somebody at the Pain Psychology Center who is fantastic. And that helped regulate me considerably. And my point was, my point,
That you can get there.
Yes, that you can get there, that there's a way out. That it doesn't mean that I'm not going to have pain. Life, I may get triggered. Something may hurt. I went for a walk today and I fell off the curb. So I wasn't paying attention. What I'm saying is that I'm alive and my tendency is always going to be to express emotion through my body. I'm just well trained. But now I get to go deeper with myself, and I'm worth it. I'm worth it. The issue for people, and I know too many people who have done so much work on themselves, and I say, well, you just need to do this, and they're exhausted. And they're like, I don't want to do anything else. I have been dedicated and committed to my recovery, whatever it is, whether it's sobriety or whatever. And I don't want to be told that I have to do something else. And I get it. It's like we have exhaustion. But to be told that there is a way out, that there is freedom, that it is attainable, and that it's not that expensive, I think that's helpful. So that would be what I would like to say.
Yeah, and you've done a tremendous amount of work and come such a long way in only 3 years. The amount that you've had to overcome, and then I think it's clear that those 3 years of intense work were coming on top of decades and decades of healing that was going on in the background. It was, preparing you for this sort of final storm that you've been in for the last 3 years. That didn't just come out of nowhere. That suddenly in midlife you were so severely afflicted. But it shows people, how much can be overcome. In my own practice, I've had patients one who was ill for 79 years, who made excellent progress once the right diagnosis was made. Another patient with 27 different symptoms that he personally was suffering from. Another patient I was asked to see, this was a teenage girl. I was asked to see her on her 70th day in the hospital. She was getting 250 milligrams of morphine a day intravenously. 5 or 10 milligrams of morphine is enough to alleviate the pain of a broken leg. She was getting 10 milligrams every hour. She had seen 6 other gastroenterologists over the previous 18 months with no diagnosis. She was successfully treated. Another patient who was hospitalized at she was the first patient in my first book, hospitalized at a major West Coast university 60 times in 15 years with no diagnosis, including by their psychiatrist. Also missed the diagnosis. So these are, some of the more severe patients out of the 7,000 plus that I've seen in 40 years. But it shows that even people with this level of illness can make a full recovery with this approach. So I think that, and your story gives a lot of hope.
Thank you, Dave. I should say, it's an ongoing process. As I mentioned earlier, I'm still struggling with insomnia. And I know it's just a symptom and it's driving me batshit because it's at night. So it's like my subconscious gets to do whatever it wants and it's not listening to me. So this is like the continuation. It's not perfect, but it's a million times better.
Yeah, I think your subconscious is so excited to finally be working on all these things that it doesn't want to stop. Which is, having some side effects, obviously, but I think it's getting happier and happier as the days go by.
I love your perspectives. Thank you very, very much.
All right. Well, I think we've covered a huge amount of ground, and I am so grateful. I think when people hear your story and they hear that this can happen to someone who has accomplished so much in her life and is still accomplishing so much in her life, that they will feel that these approaches can work for them too, and that's a great gift.
Fantastic. Thank you, Dave.